Hello and welcome to our special coverage of the spread of the coronavirus in India. Let's get you the latest figures. India has reported a 21% jump in COVID cases in a day. India has reported 27,553 COVID cases in the last 24 hours. India's Omicron tally is up to 1,525, with Maharashtra being the worst hit. As COVID cases rise, Bengal is to close schools from tomorrow, that is Monday. All offices are to work with 50% staff. Only 50 people are to be allowed at weddings and social gatherings. Karnataka has reported 1,187 new COVID cases. 923 of them are from Bengaluru alone. And in view of the rising cases, the Supreme Court is now going to be working virtually for the next 2 weeks at least. Meanwhile, Delhi logged 194 new coronavirus cases over the last 24 hours. That's 15% higher than yesterday. Remember, the capital logged 2,176 cases on New Year's Day. That was a 50% spike. The positivity rate in the national capital has now risen to 4.59%. All of this is according to data from the city's health department. Today's figure is the highest daily surge since May 22nd. The city has also reported the second highest cases of the highly transmissible Omicron strain after Maharashtra. The number of active coronavirus patients in Delhi now at 8,397, the highest in about 7 months. But the Delhi Chief Minister Arvind Kejriwal says that though the number of cases are rising rapidly, there's no need to panic because data indicates that the impact of the virus in this phase is far lesser than what was during the second wave, he says. Meanwhile, Maharashtra has reported nearly 12,000 new coronavirus cases. Of this, Mumbai has reported 8,000 of these cases, 8,063 new cases of the coronavirus to be precise. That's in 24 hours. That's a 27% higher than yesterday. The good news, though, is that no deaths have been reported. So the big story at this hour and the big question, is India going through an Omicron wave? One that we don't seem to be acknowledging. While the official figures suggest that Omicron is less than 2% of India's total COVID cases, this could be a massive underestimation. Here's an NDTV report based on exclusive information researched by Meher Pandey and Saurav Gupta, which points to a major Omicron health crisis that could hit India very soon.
Now, Omicron is perhaps the dominant COVID variant now in India. While the official number of Omicron cases in India is estimated to be nearly 1,500, in reality, it could be more than 10 times this official number, as high as 18,000, with the number shooting up every day. Now, India is following the rest of the world, which is facing galloping numbers of Omicron cases, which in some countries account for 90% of new cases. India's official numbers are so low because our country has very few testing labs or facilities that can check for genome sequencing, which is essential for all of us to be able to detect Omicron. Now, NDTV has had access to 2 labs that are able to test for Omicron, and the numbers tell a very different story to the official figures. 2 major Omicron labs in Delhi and in Mumbai show that out of all COVID cases, Omicron is now as high as nearly 60%. Another Omicron lab in Mumbai, and it's also likely to show in its next report that Omicron is 60%. That's up from 37% just a week ago. Particularly alarming is the fact that Omicron cases are rising much faster than Delta, from about a 2% share of total COVID cases 2 to 3 weeks back. It's now shooting up to 30% a few days back, and it's now close to 60% of all COVID cases. During this period, the share of the Delta variant has fallen consistently, making Omicron already the dominant variant in India. Now, this is both good news and bad news for India. The good news is that Omicron causes less severe infections than Delta, and a higher percentage of Delta patients are hospitalized, with a higher percentage of deaths as well compared to Omicron. But The worrying news for India is that Omicron spreads much faster. It's estimated to be 4 to 5 times more infectious than the Delta variant. Think about it, 4 to 5 times. Now this suggests that if this third wave does accelerate like it has across the rest of the world, India could see between 16 to 20 lakh cases every day at its peak, compared with the 4 lakh Delta cases that India had at the peak of our second wave. Now this would place an unimaginable and an unmanageable strain on our medical system, hospital beds, oxygen cylinders, doctors, and the availability of medicine. This is because even though a fewer percent of Omicron cases are likely to be hospitalized, the number of cases and infections are so much larger. For instance, if only 6 out of 100 Delta cases need hospitalization and only half that, say 3 out of 100 Omicron cases need hospitalizations, then the second wave peak of 4 lakh Delta cases resulted in about 24,000 hospital admissions. But in the third scenario, in the worst scenario, in fact, a third wave peak of 20 lakh Omicron cases would result in between 40 to 60,000 Omicron hospitalizations per day. Now, India's medical infrastructure was close to breaking point during the second wave of Delta, with potentially nearly 3 times that number of hospitalizations under Omicron. Possibly now, India could be facing a massive health crisis. The one positive we can hope for is that the Omicron wave, though much worse than the Delta wave, may not last as long as the Delta wave. Data from South Africa shows that Omicron waves may tend to both spike faster and die away quicker than Delta waves. Nevertheless, India does not appear to be preparing itself for what, at its worst, could be a terrible third wave ahead. We must prepare, and we must prepare now.
All right, so is Omicron now the new dominant variant in India? Why is it important to know that? And if so, what can you do to protect yourself and your loved ones? We're joining now. We have on the show, we put together eminent doctors for you to answer all of your questions and your concerns. We have Dr. Shashank Joshi, member of the COVID-19 task force from Maharashtra, Dr. Arun Gupta, president of the Delhi Medical Council, senior pediatrics at Fortis Hospital, and also an advisor to the Delhi government. And we have Dr. Sunila Garg, member of the Lancet Commission COVID India Task Force. She's the director and professor of community medicine at Maulana Azad Medical College and an associated hospital advisor at ICMR and to the WHO. So, Dr. Joshi, to you first. Let's start with Maharashtra because the state is reporting 12,000 new cases. Mumbai alone reporting around little over 8,000 new cases in 24 hours, 27% higher than yesterday. The only good news, of course, is that no deaths have been reported in the last 24 hours. But we had that worrying, I'm not sure why I should use the word worrying, because it's always better when our health experts give us a reality check. We had the Maharashtra Additional Chief Secretary of Health predicting that the state may report a total of 2 lakh active COVID-19 cases by the end of the third week of January. Dr. Joshi, many people seem to be asking, is this the Delta variant? Is this the Omicron variant? Why is that important that we know what it is? What difference could it make?
Well, I think, Sarah, that's a great question. And I think thank you for having me here. Happy New Year to everybody. Clearly, this is the third wave. And clearly, this is Omicron. And what you just showed before, clearly in Mumbai, at least as of now, the doubling rate has gone up in 2 days. So when you get double of doubling rate, it is Omicron. We don't need genomic really to support that.
Because it transfers much faster. So that's why you're saying this is Omicron for sure.
Right. And 90% of Mumbai now has Omicron, but 10% Delta is still there. Why do we need to decipher between Omicron and Delta? Is because Delta is the one, we are in transition time. Delta is the one which is more sinister, which is more fatal. But Omicron also cannot be taken lightly. So the main thing which we need to do is, there is no need to look at the number. This number I have called and tweeted as case stemming, which means 90% are asymptomatic. when 90% are asymptomatic, it is that 10% which I'm worried about, which is syndromic or symptomatic management. That is where we have to go and filter out the people who are at most at risk. And the high-risk individuals, whether they are senior citizens, people with comorbidities, immunocompromised states, they will need vigilance, particularly even with Omicron or even with Delta. And you see in the first and second wave, 80% of population had mild disease, 15% had moderate disease, 5% had severe and critical disease. In Omicron, 90% will have mild disease or asymptomatic disease, or maybe a little more. And only 5% and maybe 1% of that will be severe disease, or 0.5% may be severe and critical disease. And of that, probably we let us hope and pray that the figure is only 0.1% or 0.2% of deaths. So we are looking at zero COVID deaths. We are looking at less severe cases. And right now, not even 10% of our hospital beds are occupied by COVID in Mumbai city or in Maharashtra, which is a very reassuring sign, if you ask me. And all the infections which we have seen in the last week predominantly are mild cases. And the people who are likely to deteriorate are the ones who already have an additional major comorbid disease, like a cancer survivor undergoing cancer chemotherapy, or somebody who's an organ transplant survivor, these type of individuals. So it is very, very crucial to understand this point, but we have to be vigilant, we have to be cautious, we have to be alert.
Dr. Joshi, I was just going to ask you that. Isn't that the challenge then? When you are saying that 90% of these cases, 12,000 cases are asymptomatic and it's Omicron, then how do we, tell people that we should not be lulled by the narrative that the third wave or this Omicron wave is mild and it's not fatal?
Correct. So people who are asymptomatic, they need to be contained at home. And asymptomatic individuals and all human beings are restless. So it's very difficult to contain somebody at home for 10 days.
Yeah.
And people get contagious most in the first 5 days. So in the first 5 days, it is mandatory they stay at home. Ideally, they should stay at home for 10 days. And whenever they are out, they should double mask and appropriately protect themselves.
And
so it is the asymptomatics, which is the invisible, which is keep on going to spread the disease. And that is why it is very important to presume every human being you are going to come in touch with outside your home is going to be positive, and therefore wear a double mask. If you have a cloth mask, wear a 3-ply mask or an N95 mask, and do not go into crowds. And at least if there is no non-priority work, don't get out for at least 2 weeks. The wave will come down quickly. As fast it will go up, it will peak in Mumbai by around 15th of January, and it will peak in India by around first week of February. The rapidity of it is going to be very huge. And we hope and pray that we can identify people at risk and give them care and treatment which they deserve and need.
Wow, so peak in Mumbai by 15th of January. What about Delhi then, Dr. Arun Gupta?
I think the way the things are happening in Delhi for last 10 days or like 2 or 3 weeks, the positivity rate has gone up from 0.5 to almost 5 now.
Correct.
It's like 10 times. So it's the pattern has been same across the country or across the globe. So, but for public point of view, I would say don't think much about whether it's Omicron or some other virus. Your precautions remain the same, and maybe the infectivity or the severity is less. But considering the huge number of the patient going to affected, so those who are vulnerable, those who are with comorbidity, or those who are some other like disease like pulmonary problems or hypertension or diabetes, they need to be taken care properly. So I think we are at the verge of like community transmission practically in Delhi also. And today we had almost 3,000 cases. And I agree with the earlier speaker that most of them are Omicron, whether you go for genome or not. So that is the real scenario in Delhi as well. But I think Delhi government is very well prepared this time because we had a lot of we learned a lot from the last Delta wave. So the Delhi's can do 3 lakh tests per day. Now last time we had almost 1,000 cases per day where our team could manage them at home. Today we are prepared to take almost 1 lakh cases per day. Our team is ready because mainstay of treatment would be the home treatment here, because you need to call them, you need to counsel them, you give proper the medicines also, you need to monitor them also. So hospitalization will be much lesser than the Delta wave. So our team is totally geared up to take up them at home level also. I think the scenario would be same. Still, I would say the people should take all the precautions. Maybe these normal preventive measures don't work because this spreads very fast. Yeah. But still, they can delay the transmission and get some time to health workers to work on.
Dr. Garg, talking about patterns, India is following the rest of the world in these galloping Omicron cases, and in many countries they've shown that it accounts for 90% of the new cases. Now, in our case, we are going by like Dr. Joshi is saying, because it's spreading so fast, so we know it's Omicron. But our official numbers, they're low because we have very few testing facilities or labs that can check for genome sequencing, which is essential for detecting Omicron. Is that, the first failure of our government, of our systems, because a year has passed since the second wave? It's going to be in April. And we have not used that time to set up. I think we still have only 2 proper genome sequencing testing labs.
Sarah, first of all, good evening and Happy New Year to everyone. What I would like to say to everyone is that basically we have to remember, as CDC also issued the guidelines, that majority of the cases are presenting flu-like symptoms, and they are not necessarily presenting only to the larger hospitals where we are doing the RT-PCR and the other genomic sequencing. They are presenting also to standalone practitioners. Our country is very big, so the history also mimics like flu-like symptoms. So what is very important is that, as already said in earlier presentation, and Dr. Shashank also pointed out, that we all know that Omicron is faster replacing our Delta variant, and as of now we have got approximately 15 to 20% Delta variant cases, and rest of them are Omicron cases, as has been evident. But you see, nonetheless, what we see, systems preparedness is of foremost importance, which is already there in different states because of our very severe second wave, and also we have to be very, very cautious that as of now, when we are starting the use or vaccination for 16 to 18 years or 15 to 18 years, we should come faster, and we should move extensive so that you can come fast and get the vaccination, because that is one thing which is going to prevent you from hospitalization and death. This is one of the challenging situations, and as per CDC guidelines also, it has taken into cognizance the world scenario that we must resume all the like cases, also like Omicron, but we have to only give the symptomatic treatment, be very cautious and follow with appropriate behavior. That is important. But then again, we have to keep watching the situation, because you see, this is a mutant virus. Unless you see everyone is vaccinated, I'm talking of not only India but across, the mutants will keep coming. So that is where it's a question of between equality across the world. Whichever countries have got excess vaccines, must give to other countries as well. There is no reason why should we be hoarding the vaccines. So this is my first and foremost thing. The systems are prepared, but most important is wherever the message should go, from the platform to all the standalone practitioners, all the hospitals, whether they are COVID-19 hospitals or not, follow and treat every individual of flu also like that of suffering from COVID-19 infection.
All right. Can we also just reconnect to Dr. Garg so that if the next question we can hear her a little more clearly? I have a feeling that the line just needs to be refreshed there. Dr. Arun Gupta, talking about the importance of vaccinations, then the timing could not be better to start vaccinating our youth. 15 to 18 begins in a few hours from now. Already 5 lakh people have registered on COVID for this vaccination for teens.
I think it's a very, very welcome step, but still I would say we are probably last in the block to take off. I think the most of the country in like USA and some country in Europe, like Germany and the other countries, like they have started vaccination in the 5 to 11 years category also.
Correct.
And in fact, some countries like China, Hong Kong, or Bahrain, or some Middle East country, they have vaccinating children up to 3 years of age also. So I don't know why we are also always last to get on the block, but I think it's a welcome step in the right direction also. And already the DCGI has given approval for the age of 12 years for Covaxin. I think government should consider it very, very soon, so that the children up to 12 years can be vaccinated. And I think studies have been completed, because studies were conducted between 2 to 6 years and 6 to 12 years as well. So I think those two categories also can be considered as soon as possible. I think every children up to the age of maybe 2 or 3 years beyond should be vaccinated as early as possible.
So then, Dr. Gupta, what should parents of children who are of the age 15 and under, what should they do? We have to get through the next 2 weeks knowing that your children are the ones in the whole family who are unvaccinated.
I think that is a big question. As a pediatrician, I get so many calls a day from the anxious parents. Now, first I would address the parents whose kids are beyond 15 years of age. I think there should be no worry. Vaccine is absolutely safe. They should not a cause of anxiety. They should go for vaccination. Everyone who is beyond 15 years. Now, for the younger children, their anxiety is very, very natural. They think if the children go to school, they can get the infection. From them, the best bet is all the adults in the family. They should get vaccinated first, because the adults are the one who bring the infection to the home and get the other infected. Otherwise, this is up to government to start vaccination these kids as early as possible. As I already said, that the vaccine has been approved by DCGI and studies have been completed. So I think they should go for vaccination as early. And the parent anxiety is very natural, and this is up to them to decide whether they want to send their children to school or not.
Right, Dr. Joshi, last word to you again on any messages to parents who have kids under the age of 15, under the age of 10, and I think there's no question of schools sending your kids to school, because it just looks like most states have already called it that schools are going to be closed.
So first thing is, people between 15 and 18 go and get vaccinated. I still see some hesitancy with parents in that age group. So break that hesitancy and get the vaccine. Covaxin is a very, very safe vaccine. And as Dr. Gupta rightly mentioned, the studies have been done between 2 to 15, and I hope that Government of India in the next 2 to 4 weeks or in the near future also takes that group into account. Remember, children below 10 have some thymus and some natural immunity also. They are reasonably robust. Viral infections are better handled by our children population compared to the adults. Nevertheless, it's a vulnerable group. It's a reservoir. It has to be vaccinated. And India, one thing is very good, that in the adult world, 90% have got 1 dose, 65% have got 2 doses. Now the teenagers are getting it. And I'm reasonably certain that even below 15, parents need to get vaccinated. Beyond them, all their family members need to get double vaccinated. And also, COVID appropriate behavior has now substituted. So I think wearing a double mask when you are in a crowd or when you are outside is mandatory, whether you are a child or an adult. It is, and sometimes I have found that children are more compliant than adults. So adults have more rebellious and revengeful behavior. Yes. But children, if educated properly, are our future, and they do a better job sometimes and teach their parents and grandparents how to wear a mask appropriately.
Well said, Dr. Joshi. Well, thank you all. And of course, we haven't mentioned the fact that we've reached the end of the year. Yes, Dr. Garg, we've reached the end of the year. Yeah. Go ahead. You want a closing argument, but I do want to mention that the government had made that claim very ambitious, that all of India, everyone who's eligible, would be vaccinated by the end of the year. At that point of time, when they were asked, how is this possible, given the numbers, given the stocks, given the supplies, the government claimed that this would be the case. Of course, we've reached the end of the year and only about 60% of India has been vaccinated. But you wanted to make a point, Dr. Garg. Go ahead.
Yeah, Dr. Sarah, we have got, hybrid immunity. One is the vaccine acquired and the natural immunity. That is important part. The second part is that school opening or going to school should not be linked to the vaccine.
We have natural immunity as in?
Natural immunity as well as vaccine acquired immunity.
Sure, but when you say we have, you mean globally or
India
just
has.
Indians or?
India has got 70% of immunity, which can be attributed to the natural infection, and the rest from the 146 crore.
Oh, okay. Is that a scientific well-known fact that Indians have more immunity?
Yes, we have. That's how we have got much lesser chunk of infection as well as, the severity of infection.
Okay. Dr. Gupta, Dr. Joshi, this is a known fact, scientific fact, you agree?
Yeah, I think one way to put it like because India is being a tropical third world country, the natural infections are much more common in India.
Okay.
So we have some antibodies against most of the common bugs around us. So that's why our kids are less prone to those infections as compared to the European or American, where they have less exposure to these infections. So that can be one of the way of putting it. But as far as Delhi is concerned, in last wave, almost more than 90% people got infected, and they have robust immunity against this coronavirus as well. So I think there is a, however mutation they may be there in Omicron, but some cross immunity or some cross antibodies are always there. So some protection
but then
is always
our
there.
experiences should then be different from what we're seeing in other countries, and that's not necessarily the case. But unfortunately, I'm out of time, and this calls for an entire different show to discuss this. But thank you all for now for helping us understand the difference between the Omicron and the Delta variant, and which variant we're actually fighting against in India, or which we're up against in India right now. Dr. Joshi, Dr. Gupta, Dr. Garg, thank you for your time and thank you for your service. Thank you. Bye-bye.